I'm Kara Morgan. Thanks for joining me on Pacific Northwest News and Entertainment Health Talk, sponsored by Lincoln County Health and Human Services. And today I'm excited to be with Shelley. Hi, Shelley.
Hi, Kara.
So tell us a little bit about yourself and what you do.
Okay. My name is Shelley Paeth. I'm a registered nurse, and I've been working for Lincoln County for almost 40 years. And my area of specialty is in the maternal child health program and specifically nurse home visiting.
So tell us a little bit about these programs that you oversee.
Okay, so the first program that I'm going to focus on is a program called Family Connects, and we started that program in 2017. So we're coming up on our 2-year anniversary, I think, pretty soon. And that program came out of Duke University on the East Coast, and it is what we call a population-based home visiting. So it's a service that's open for everybody. And that makes it unique because it's not based on somebody's income, it's not based on the type of insurance you have, and it's not based on any kind of risk factors you may or may not have. So it's just for everybody that has a new baby in our community.
Oh, okay.
Yeah.
So it's for new families.
It's for new families, and it can be for if it's your first baby or your 5th baby.
Oh, okay.
Yeah.
Wonderful.
Mm-hmm. Yeah. So it's a focus. The Family Connects is a focus on when a woman has a baby at that time, that immediate kind of postpartum time, like that first 2 months. So how it works is that we have 3 nurses that provide that program, and we have 2 hospitals in Lincoln County. They go every day to the hospital, and they greet whoever has delivered the night before or the morning of, and we explain who we are and the kind of services we provide, and then we set up a visit. And our goal is to really do the visit probably about 3 weeks after the baby's born, give or take a little bit. Many times women have that baby visit, like at week 1, and then they don't have another one till like week 5 or week 6. So we like to be kind of in between those doctor's appointments, and so we kind of aim for that. Sometimes we go earlier because women need some support around breastfeeding or other things. So we're very flexible in that area. The program is really, and again, it's intended for everybody. It is at no cost to people, so they don't have to worry about paying for this service. We come to your home, or we come to a place that you feel most comfortable. So we're very flexible around that. The nurses do a physical exam of the baby. We just do a double check, make sure that baby isn't jaundice or yellow. That's a common thing. We make sure the baby is gaining weight. Most babies lose weight and then come back up, so we want to make sure things are on the upswing. We check all their reflexes. We make sure that they have a good suck, no problems with breathing. So we do just kind of a basic physical.
Kind of a baby wellness.
Yep, little
check.
baby wellness check. But then we go into we have about 12 things I think that we focus on and make sure that people have the resources they need. It could be anything from food to housing to transportation. Do they have a baby doctor? Do they have a doctor for themselves? And then when we determine that maybe they might need some help with that or some resources, then we help them make those connections. The research out of Duke University really shows that if we can connect families at this time with those resources, then it really makes a huge difference on how people utilize the emergency room and how they utilize their own doctor. So it's really it's a overall cost savings if we can do that kind of intervention sooner.
So are the nurses available if a parent has a question in between visits?
Absolutely. So when we go to the hospital and we offer our services, we set up our phones so we can begin texting, because that's how everybody works, and You know, it is, and actually it makes it really nice, right? And so we will we encourage them to text us if they have any questions before we come, and then we can get back to them, and then we have that ability in between times as well. So,
how important is a program like this for new parents, especially?
Well, we feel that it's really so. Duke University really felt the need to, if you're going to bring up your community, you know, and bring up the services and just how we want the health of our community to be, there are certain places that you need to provide that for everybody. And we know that when families have babies, they're very vulnerable and they need lots of support, and that goes across all economic situations, and so it's important when we provide it to everybody, then the whole community rises up to that, and it makes it very normal and very accepting. And because we never know how our own bodies are going to react. It doesn't matter if you have Blue Cross and Blue Shield if your milk isn't letting down, right? So it does, those kinds of things just don't play into insurance. So we just want to be there to support women in the goals that they have set out for themselves. So that's why it was really important when Duke first started doing this to not do it just to what we consider high risk, that we do it to everybody. And so when I first read this research back in 2012, I thought this is what we need to do out here. I've always felt very strongly about that. So we actually were the first place west of the Mississippi to provide this program. And like I said, we started it in 2017, and now with the last legislature, they passed a law that the state of Oregon is now going to start doing this. And so it's very exciting that Oregon has stepped up and realizes the value in providing this service to all Oregonians. It's a volunteer program, so it's not something that people are required. And so it's just really exciting to see that move in that area. So that's why I just feel that it's just so important to provide for everybody.
And Shelley, what are some other things that you do here that help families?
Okay, so that Family Connects is just kind of that little snippet in time right after the baby is born, right? But we do have some other home visiting programs that are just as unique and great. So we have what is called Nurse Family Partnership, and that is a program that is out of Denver, Colorado, with Dr. David Olds, and it is a program that focuses on first-time pregnant women, and because we do know that when you're pregnant for the first time, you have less knowledge, right? And you're also
there's no handbook.
There's no handbook, and we also know that that's the time when people really want to learn a lot. They're just like sponges, and so we offer this service to all first-time pregnant women in our county. We have 3 nurses that do home visiting, and again, I say home visiting, but many times they come to our office. We meet at the library. We meet where they want to meet, and it's what we call a little more intensive program. We usually do visits about every 2 weeks. We start in their pregnancy, and we of course we provide the standard things about labor and delivery, breastfeeding, and what to eat, you know, changes that your body's going through, all those kinds of things. But we also get into what are your educational goals? What do you want to do? Because
interesting.
Yeah, because sometimes women that get pregnant, they haven't completed their high school education, and so we help get that in place if that's what they want to do. We help them get their GED. We know that if women have graduated from high school, then they're going to be more employable, and when you're more employable, you're going to provide a better foundation for your family. So we talk about educational goals with families. We talk about work goals, what's their dream? How do we get those dreams? Because many people don't realize that you can dream and attain that, and we just help people set out goals for themselves and take those little steps to do that. we also talk a lot about what your hopes and dreams for what you want your family to look like. What if you want another child, what kind of spacing would that look like for you? And then how do you make that happen or not make that happen? And so we give lots of support. So it's really helping women think about what it is they want for themselves and their family. And it's not us telling them what to do, it's them telling us what they're doing and us helping support that along the way. So some women want to, let's say, cut back on their smoking or quit smoking. We would give them, support and help around that. Sometimes there's drug and alcohol issues that we would support around, domestic violence, just all sorts of things. However, people come to us and might get in the way of them attaining their goals and becoming the best parents they can be, we support that. So that's a much more intensive program. We start in pregnancy, and that goes until the child is age 2. So we really get to know those families, and we really so we serve about 75 women at any one time in that program in our county. And
you serve all of Lincoln County, is that right?
We do. We serve all of Lincoln County. Yep. So that's and like I said, we have three nurses that provide that program. So you can see, Family Connects is right after the baby's born. Nurse-family partnership happens in pregnancy. We start offering those services in pregnancy. Again, there is not a cost to that program. Now we do kind of have what I refer to as our Babies First program, and it kind of is a cushion on either side. So if we have a woman that's pregnant and it's her 3rd baby, we would still offer home visits to her, but her needs are very different than the first-time mom. So we check in with her. What is it that you want to review? What do you want to learn? And then we follow their desire. Most of the time it's things around labor and delivery. It might be about, I didn't breastfeed my last baby, I want to do it this time. So we do lots of teaching and education in there. So we do some kind of unique home visiting based, and a lot of times women, they're back to work, and so they don't have maybe the ability to meet as often. So we kind of follow their needs. Sometimes we have infants and children that have special health needs, and so we will continue to, and that's in our Cocoon program, and that is a program that we can continue to see those children a little bit longer because they have chronic health conditions, and so in that.
So can you give some examples of some of the things you see?
Yeah, right. So that could be a family that maybe has a Down syndrome child, a family that has a child with a cleft lip and palate that is going through a repair, could be some kind of a cardiac problem, could be a child with fetal alcohol syndrome, and it's a health condition that will stay with the child. And so with those families, we really support the family on, we know you're going to be the coordinator of this child's health, and that's a new role for everybody, right? It's like seeing the world through a different pair of glasses. And so, how do you manage going up to OHSU and to Dornbecker? Where is the front door? Where do you park? So how I didn't quite understand what the doctor meant by this. There have been times where we've actually gone to appointments with families up there to just be another set of ears, and because we know that can be overwhelming, and sometimes the conditions are so unique that we may not even be really familiar with it, and so we want to hear that information firsthand. But we're certainly not the leaders of that child's health care. We know the parent is, and so it's really helping those parents make those phone calls and helping them figure out, where do you get a wheelchair, where do you get diapers, where do you get special food supplement, all that kind of stuff. So that program is a little unique in that it's about chronic health conditions. So you can really, we have 6 nurses that do home visiting. So any one of our nurses could be, seeing, a pregnant woman. They could be seeing a mom right after birth, or they could be working with your family with a 3-year-old that has spina bifida. So could be a real mixture there.
What are the most common things that you come across, especially with new parents? So much has changed over the years.
We know lots, don't we?
And we hear all these different things. They can't have fish, they can't have peanut butter, they can't have honey. They can't
I would say probably one of the biggest things that have impacted us, I don't think it's necessarily new to us in the field, but it is new to everybody else. The research is catching up. It's around infant mental health. We used to think that kids, infants didn't wake up till age 3, right? And what we know now is they start taking in everything the minute they're born. They're looking around. They're very attuned to your voice. If you're the mom, they've been listening to you for a long time. And we know that the things that parents do around that child can really be helpful for that child or be adversely affect them.
Babies really pick up on the emotions around them, especially the parents.
Right. So we really work with families about the words that we use around our children, how we interact with them, the importance of interacting with children and talking with them. If you want a child to talk, you need to talk with your child. And it's really challenging. We've got all these devices that, people can be on. They can be watching TV. So sometimes it's hard to interact, right? Because we're set up to do it in a different way. We also know that the things that have happened to us as parents adversely, when we were younger, really impacts how we parent. And even though we want the best for our children, because I believe all parents do, sometimes when we have had things happen to us, it's hard to be our best, and it's hard to even be aware that I might be doing something, as simple as, instead of holding my baby like this and looking at my baby, sometimes I turn my child the other way because I think they want to watch that little Walt Disney movie going on, right? I mean, it's not uncommon, but what we know is that the best thing, babies love our face and they love that interaction. So it can be, parents try to do the best, right? They think what's on TV, National Geographic, doesn't have to be Disney, that's, but really the best is the parent. So I would say that, that is probably our biggest learning curve is that, children just from the get-go are really taking in everything that you do. And when they hear yelling around, that can really adversely affect them. And they can shut down and they cannot bond, they cannot attach. And then that creates a whole host of problems. So I would say that's, when we often rely on our grandparents or our parents in instructing us what to do, that's where sometimes the grandparents may not have that latest information. And
how important is it of parents and grandparents being part of a baby's life? I'm very involved.
Well, yeah. Well, then I think you answered your own question. I think that we want to surround families with lots of love and lots of support. I think that parenting is really hard. It's just hard.
And every child is different. So what may have worked for your first child may not necessarily work for the next one, right?
Absolutely. All we have to do is just look at our own siblings and realize how different we are, and oh yeah, why did I even think that it could be the same, right? So sometimes when I stop and think about it that way, it makes much clearer sense to me that our little babies would come to us very differently. But I think surrounding new parents with lots of love and support is important. But that's not the way it is for a lot of people. For some, they don't even have family here, right? So that's not even a possibility. And then sometimes families have families that are in crisis. They're in their own, they have their own set of problems, and sometimes that can adversely impact these new parents because, something is happening over here. And so as much as, I want to surround people with love love. It's the love that I want surrounding them,
yeah,
the support,
the positive,
not the
is
drama
more important.
and things like that. Yeah. So yeah. But can anybody ever have too much love?
That's right.
Yeah. No.
Especially babies.
Right. Yeah.
All right, Shelley, is there anything else that you'd like to add?
Well, I just want to say that most of our referrals come from our obstetricians, and and I'd say that about they're very good at supporting us and supporting our community in this way, because doctors, obstetricians, pediatricians can't do it all themselves. They already have a very full plate, so we're kind of just a little a support for them. And so, but I would just say that if you are in the community, and maybe we have people that move in, people can call us and refer themselves and ask for services. And
good.
so it doesn't have to come from their doctor. And if you thought at the beginning, like, oh no, I've got this new baby stuff down, and then your child turns 3, and then all of a sudden starts crying a lot, and like, I don't know what to do. We're a really good resource for that. So even if you stepped out at the beginning and then want to step in later, it works for us. We're just
great.
here for you. Yeah.
Wonderful.
Yeah.
Well, Shelley, thank you so much for joining me today on Health Talk.
Great.
I'm Kira Morgan for Pacific Northwest News and Entertainment.